Do you guys have your favorite patient? As in, maze, this is my favorite disease, bana. Maze, mimi mtu akiniletea cholera mimi kwa home. Do you have that?
No, I don't think there's a favorite illness.
But
there are some favorite patients, like the patient who does as instructed. Yeah. You know, you actually look forward. I don't know if you've had. Then there are those we call.
Not, of course, there's that.
We call science patient, the one who followed prediction, like you knew, but no, I don't have a favorite illness.
And by the way, also there's those at the back of your mind that I wouldn't use the word favorite, but those that you actually know that if this comes to me, I've seen like 100 of them. Okay. So upper, when it comes to experience, you're actually really comfortable. Then there are those that come in that you probably have read about them, but haven't seen so many of them, you see.
As in, nauliza favorite in terms of, maze, patient alikuwa sawa, I'd love to treat you again.
No.
As in, maze, see you soon. As in,
no. We want you to go. Go and be fine. Don't come back. Preferably.
We don't want people to be sick again and you come back and treat you.
Maze, come back.
No. Once you're well, you're good. We just pray that you don't come sick again, you know.
You guys don't have that relationship with your customers?
No, we don't have that separation anxiety. However, we hope that our service was good for you. Yes. That if you find yourself in a similar situation, that you actually trust us enough to come back.
So what does it take to make a doctor from high school? As in grade minimum, kwanza?
Yeah, so you need to score A's.
Zote?
Yeah. A's.
Zote?
From high school A's. Once you have your A's, because the cutoff is really high.
50 unaenda kupatia mbele.
50 sasa ni the 50 is the minimum, I mean. And the thing is that because medicine is very tough and very intense, is that getting that 50 isn't as easy. You see, it's actually an achievement getting it. But nothing, and it's just that a good number, by the way, it's a small number who will get at that 50, but a good number of the students surpass that mark, 70s, 80s, credits, distinctions you do have. Yeah, so.
But the interesting thing is, apart from grades, discipline, passion, there are other things that keep you in that still keep you in the profession, actually.
Thank you.
That's and then the clinical acumen.
Because
clinical acumen.
Acumen, yes.
Okay, so
because discipline, it's one of those things, and I guess like the difference between high school and campus is the fact that you have all this load of work to do, but no supervision.
Precisely.
You're staying away from home. If you're coming from high school, you're used to preps, bells ringing, people pushing you. Now it's you have work and nobody pressuring you.
And but then let me add to that, the beauty about medicine is, if you don't read, you will never know. In fact, I remember one of our lecturers used to say that the geniuses realized other professions and went into them. In medicine, you have to read like an elephant. So if you don't read, there is no way you will walk into the exam and pass.
What if you have a D, but you have passion? Ukona D na passion.
So the first cut-off, pass mark. You can't make, if you got a D, there's no way you can go in there.
Now you have to read like an elephant.
Yes.
Mama yangu hajawahi enda medical school ya mtu but anajua Brufen. Kuna time my mom ama every African mother anaweza kuangalia sikie akufanye hivi na akupe dawa na upone.
Kwa sababu gani? Because
experience kidogo amekupeleka clinic wakati mwingine
kila daktari akikuona alikuwa anakupatia Brufen, so akajua hii na Brufen inawaka. But
there's a danger to that.
What is the danger?
Side effects. Sometimes you'll miss the illness. You know, some illnesses behave the same. One small difference can change the whole treatment plan.
Okay.
So perhaps bring it into context is this. The child has pneumonia, which is a respiratory tract infection.
Yes.
And one of the manifestations is fever. So you give the Brufen. You're not treating the cause. You're treating a symptom, which is the fever. So you give the Brufen, fever goes down. After 1 day, 2 days, the fever. So the damage is happening because the causative agent is a bacteria.
Okay.
So you need antibiotics. Once you've treated the cause, then even the fever will go.
Mumesikia.
And then
ukipea mtu Brufen ikatae kufa. Yes.
And then you go to hospital late when the disease has also progressed. Umekuwa ukisuppress the fever, but the disease process is going
so basically with the diseases you have to keep time.
And you know that especially for children, by the way, I think this needs to come out where we've seen children who've been kept at home for 5 days, you know. fever, they were treating fever. They thought
Diarrhea.
the child was diarrheaing, water, child was convulsing, because now the disease progressed, child was convulsing, then now bring them to the hospital. So you get a baby or a child who is extremely sick, the disease has gone to its severest form, and you're supposed to treat. And then sometimes, unfortunately, those are the babies, unfortunately, sometimes you lose. You know, very young children, 2 years, 3 years, who stayed at home for so long, they come in late. So you institute your treatment, but unfortunately, it's a bit too late. So there's also a window of opportunity. So it's important to take someone who's not feeling well, who's feeling sick, especially children, early.
And you know, children don't talk.
Yeah.
So you'll use other signs to find what the problem is. So you suppress it, but the child cannot tell you, I'm also feeling something else. You understand? So you're suppressing this, but the child can't express. So they just continue getting more sick.
And like an adult, me atakwambia, maze nipeleke hosi. You get?
But then, doctors, ukiwa mgonjwa unaweza jipeleka hosi? Unaweza treatiwa na Mwachonda ati sifeel hivi na hivi na hivi?
Yes. We actually treat each other.
Ulienda shule kufanya nini basi?
No, mganga ajigangi.
Thank you. Now I refer to as waganga moving forward on this interview. Kwa nini? When I come to see you as a doctor, nakwambia how I'm feeling. So you have to
I have the ability
to tell how I'm feeling. But this one, ni wewe, you are feeling it.
Because I might not be objective. You see, when it's even your family member, you might not be objective. There are questions you won't remember, they won't come to mind. But the interesting thing is, if someone treats you and they miss something, you can actually contribute to their treatment plan and tell them, and what about this doc? But you can't treat yourself.
Or you can
because
suggest
you can't
them,
be objective.
Nidunge hivi, you can make suggestion vile unataka afanye.
No, not ati vile unataka afanye. You see, if you're treating a colleague, the conversation is different than if you're treating somebody who has no idea. It's now a discussion.
Oh, you use abbreviations.
No, it's a discussion.
No, it's a discussion.
Now you see the difference. Like if you came to me,
Yes.
The way
I'm a doctor to pay an example.
Okay, so anyway, the difference between the patient who is not a doctor or a medic is that hana background.
Yes,
so much. So you have to try and filter all this scientific information and clinical information you have to the simplest language. But if it's a doctor, you are at the same level in terms of information, clinically, scientifically. So the discussion now becomes, by the way, doc, you know, you have this and you understand the effect of this. So we're going to give you this drug. And so because you're giving you this drug, you understand this. We're going to take this path, we're going to take a sample to do this investigation. You get? So then you already know. So even when the results come, the minute they say, let's say you're just checking your electrolyte levels, which is your sodium, potassium in the body. You were told potassium is at 5, you already know, okay, that is already increasing. You know?
But and now the other issue is we tend to also overthink. When you're unwell and you feel something, your mind processes way more than what is actually happening. So you can't.
And that is why you cannot treat yourself.
When it comes to practice, what's the hardest part your job?
Loss of a patient.
The hardest part for me, I'll be honest, is not treating. The hardest part is dealing with outcomes of treatment that are not up to what you expected. Like
dealing with outcomes?
Yes, outcomes. Like I see a patient and I've done everything as per the book. My expectation is that tomorrow I'll discharge this patient to go home. And I come and the following day the patient
is gone.
Either dies when I'm there or died. That's very tough. The other part is actually talking to people about their illnesses when they're very severe. Like here we are now, we are looking at palliative care, which means we can't treat you anymore to make you recover. That's because that's now human connection.
And have you ever written off a patient halafu ukakutana na yeye Yesu alikuja na hakutumana, so he's out there walking.
It has happened.
Sidio mimi huyu. Sidio, daktari gani? Have you ever had such a case?
No, not for the patient was not expressing themselves like that, but there are patients who you see them and in your mind you're like, this one I might not find them here tomorrow. And actually tomorrow they're very happy to see you.
Not tomorrow. I'm talking about a year later. Strong.
Oh, a year later.
Let me tell you, but they are very interesting story when you're talking about that. So I think this is almost 5 years ago.
Yes.
Patient comes in, cut by a panga here. bleeding. So
imefika kwa pulmonary artery.
It was half an inch.
Tuongee kama we know these things.
It was half an inch from the jugular and the carotid. So by the time because he'd been clamped ni hizo scissors ndogo. So we opened each suturing. By the time we opened it fully, in fact, we just said, this guy is lucky. It was half an inch. It has cut up until half an inch remaining to get to the jugular. See you see this pop here?
In the outskirts,
where there's this just beneath the skin. We did our best, and he'd lost a lot of blood. Of course, when you try we had finished now, we were trying to open him up. By then, this story was very interesting because we were 3 of us. Out there, the entire community has come. So we saw him, he was pepper white, like there's no blood in circulation, very little. So we called the lab, we got 4 units. He was very lucky. So one of us had to actually unscrub from theater to go and talk to the relatives just to tell them, by the way, we have managed to stop your bleeding for the patient, but it doesn't look good, because we knew him surviving was going to be difficult. In fact, we did our best. We had to pump in the blood using syringes, not let it run through.
Yes.
So after 3 units of pumping it, the guy actually did. I can tell you, the anesthetist jumped and said, Jesus Christ.
Akarudi back to life.
Yes, and then the interesting thing is 3 months later, I'm in the hospital corridor.
Yes.
I hear someone tap me. I'm like, yes.
It was the guy.
Unanikumbuka? Nikamwambia no. Mimi nilikuwa nimekatwa hapa kanionyesha.
So basically,
I was like,
moral of the story ni mwenye alimkata na panga knew when to stop.
I don't think alijua when to stop.
But he stopped at the right time.
Yeah, he was lucky.
Na wewe hauna story ya nini kuokoa maisha?
Actually, now that it's narrated, I remember this lady, and this happened actually about 4 months ago. So this lady had been treated for a heart disease and had been started on treatment, and then she got a reaction, an alapri.
Yes.
And so she got what we call angioedema. Her tongue was very swollen. It was really bad.
Swollen as in?
Ikaja kwa mdomo.
You can't see through.
So she could barely breathe. It was really bad.
Yes.
So of course, what happens in some illnesses, it changes even your appearance. Like how you look when you're well, and how you look when you're unwell is very different.
Yeah.
And so later on, maybe 2 weeks later, I walk in and I sort her out. Now she had come in with high blood pressure, and we were trying to reduce that. So I'm sorting her out. I'm going on with my business. She's like, I want to talk to you, because now my shift was over and I was about to leave. She's like, I want to talk to you. And so I joke about it. I'm like, hey, you want to talk when I'm about to leave? So she's like, no, you have to come and talk to me.
Yes.
So I go back. She's like,
but see, her tongue is swollen.
No, this is after she's better now.
Oh, now
this
she can talk.
Another time.
Yes.
That has been sorted and it has resolved.
Okay.
This is 2 weeks later.
Yes.
So she looks like a totally different person.
I'm a transformed
kabisa. I can't even. She's like, have you ever seen me? I'm like, no, I have not seen you.
The last time I saw you, couldn't talk.
No, I can't even remember that she's the one.
I'm a change kabisa.
Then she reminds me, and I just was like, wow.
And when you meet such people,
no, but it is now that affirms. It affirms the work that you do.
And when you meet such people, kama huyo wapanga, don't you get the feeling, you owe me your life, man? As in,
no.
I think for you, the satisfaction is that he came in a state that was what you call near death.
Yeah.
But out of the actions that you did, he survived and is walking. That gives a lot of peace and satisfaction, knowing that I've helped someone actually stay alive. But it's not you.
It actually gives you a lot of humility.
It's not you who say,
I think it actually
you're being
puts
modest. You can't take the credit.
It puts you in a state of humility. It is just humility, by the way. There are things you don't take credit for. It's not possible. So it means you'll take blame for the ones who die.
Okay.
You know what I mean?
Yes.
So you can't pick this and not the other. It actually puts you in a state of both outcomes.
Yes.
Very good and very bad